So hi everyone, I am Dr. Annie George and I am from Biotropics Malaysia Berhad. Today I'd like to share a little bit about the immune system, and I have with me an expert who has more than 50 years of experience on immune research, and he is based in Tokyo Dental and Medical University, and he has come up with a very interesting and novel way of measuring our immune system. So without much further ado, I would like to invite Prof. Hirokawa to tell us a little bit more about the immune system.
Okay, thank you, Dr. George, for your kind introduction. Now, everybody knows global propagation of coronavirus COVID-19. Each government is informing that how to protect yourself and what to do if you are sick. So I'm now going to talk about the immune system. Just for your information, I would like to show you death rate of COVID-19 infection in Italy. On March 17, you can see a tremendous increase of death rate in elderly people. This is related with elderly people who have many underlying disease, and actually immunological vigor is low in level. At this point, I'd like to briefly explain that our body is protected by 3 layers of system. The first is skin and the mucosal layer. The second is natural immunity. The third is acquired immunity. Then I have selected important cells which are susceptible to infection, stress, and aging process. They are T cells, B cells, and NK cells. Many people are working for the stop of immunological decline, and most studies agree that improvement of lifestyle is effective, as shown in this slide. Food, physical exercise, sleep, avoid stresses, and stop smoking, and stop heavy drinking are major targets of improvement of lifestyle. There are many supplements appealing good for your health or useful to increase immunological vigor. But unfortunately, most of them have no scientific evidence. We have examined so far many kinds of supplements from immunological viewpoint. We found that effectiveness is different by people. In particular, regarding one sample, when examined in 10 people, efficacy is observed 5 people, but not in other 5 people. The number showing positive efficacy is different from sample to sample. These results are acceptable to us because people are different by lifestyle and genetic background. So when you take some supplement first time, carefully watch your feeling and body reaction. If there is no adverse effect, continue to take it for months. If possible, check your own immunological vigor. Then you will know the effectiveness of supplements you tried. I would like to introduce one unique supplement, Tongkat, which is made in Malaysia. We examined the effects of Tongkat on the immunological vigor in human volunteers using the method already mentioned. The result clearly shows that, as compared with placebo group, a significant increase was observed in the number of lymphocytes and the T cell and in the level of immunological vigor. The effect was examined by comparison between two groups. People of one group was given Tongkat early, and the other group was given rice powder as control. After 4 weeks, the effect was examined from various immunological viewpoints and compared between two groups. Results showed positive effect of Tongkat X-ray, and effect was statistically significant. So here I would like to give an important talk of Dr. George, who started to examine the immunological effect of Tongkat eye.
Thank you, Prof, for that very interesting sharing. Physta Tongkat Ali was evaluated in Tokyo Medical and Dental University in Japan, in the Prof. Hirokawa's laboratory, where we evaluated it looking at the score of immunological vigor. And what was found was that when it was evaluated in the Japanese population who had fatigue, both men and women, upon 4 weeks of supplementation, the score of immunological vigor improved in the group that took the Physta Tongkat Ali. And this improvement was about 4.7% improvement, and this is statistically significant. And when we looked at the individual parameters that contributed to this immunological vigor, we saw an improvement of between 7.7% in lymphocytes, right up to 21% in the naive T cells. So this improvement shows that Physta, a standardized extract from the root of Tongkat Ali, is able to improve and enhance the score for immunological vigor. Now, Prof also did mention that stress is one of the things that actually can reduce our immunological vigor or reduce our immunity. Now, Physta was actually evaluated also by Dr. Sean Talbot, a nutritional biochemist in US, and he also is the author of The Secret of Vigor. When he looked at the effect of Physta in moderately stressed men and women, he found that after 1 month of supplementation, and when he looked at the score for mood, looking at the questionnaires, he noticed that there was a reduction in tension, anger, and confusion in the population that took Physta. And when you compare this with those who did not take anything, which is called the placebo, there was an improvement in the group that took the Physta. And this also corresponded with a reduction in the cortisol levels, which is also known as the stress hormone. I'd like to just summarize what Prof. Hirokawa has shared with us today. One is the immunological vigor is made up of the natural immunity and also acquired immunity, and we can boost our immunity by a healthy lifestyle choices. So one is with nutrition, exercise, sleep, reducing stress, and also with the supplementation of ingredients which has been clinically proven to be able to improve the immunological vigor of a person. So with that, Prof, I'd like to thank you so much for your sharing. That's very informative and interesting. And this is Annie signing off, wishing all of you to stay safe and be kind. Thank you.
Thank you.